Welcome to Deciphering Growth, the show that explores mental health from every angle. We bring you conversations with personal opinions, stories, and practical tips. We aim to break down the stigma and help you live your best life. So please sit back and let's dive in. Before we begin, we want to remind our listeners that this podcast represents the opinions of Tiffany Graves, Eric Stone, and the show's guests. The content here should not be used as medical advice. It is for informational purposes only, and please consult your healthcare professional for any medical questions. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast should not be in any legal capacity whatsoever, including but not limited to establishing a standard of care in a legal sense or as a basis for expert witness testimony. There is no guarantee regarding the accuracy of any statements or opinions made on the podcast. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship.
All right, guys, welcome back to another episode. Today, we are going to look at trauma in the healthcare systems and kind of what that looks like. I'm going to toss the ball over to Eric, and he's going to kind of like hit us with a definition of kind of like what we're going to be exploring today.
Yeah, so I just want to give credit to where this is coming from, like this definition. So this is from PCOM, the Philadelphia College of Osteopathic Medicine, and their definition of medical trauma is the experience of traumatic stress as a result of interactions with the medical system, which may include procedures, i.e., surgeries, new diagnoses, and professionals in healthcare settings. These healthcare settings may include primary clinics, general health hospitals, uh, specialty clinics, among others. And just to give one more example from Psych Central, to just go, when we are talking about medical trauma, we also are talking about things like medical PTSD. The medical PTSD, this refers to symptoms that meet the criteria for PTSD, originating from trauma in a medical setting. Medical trauma, this is a trauma that occurs in the medical setting while not an official diagnosis in itself. Medical trauma can lead to conditions like PTSD, anxiety, depression, or chronic pain. And I'm going to throw it back to you, Tiffany.
Yeah, I think that's a pretty all-encompassing definition. If I was to say so myself, it really kind of doesn't leave much for me to add to.
I mean, it does. I think like we need to have these definitions in detail because trauma, as we are on a trauma podcast, trauma has become a buzzword.
Mhm.
And so sometimes people would maybe qualify a receptionist being slightly rude as medical trauma, or maybe a provider was 5 to 10 minutes late. That is not what we're talking about, just to be specific. We're talking about maybe a provider completely forgetting your appointment, and you've had that happen to you've had 5 different therapists. That could be a
Mm.
trauma. Or having someone actually be unprofessional. So maybe like getting very aggressive, or maybe not using a trauma-informed approach in a procedure. So those are things when we're talking about medical trauma, uh, that we're kind of getting to. And so, Tiffany, do you have any examples of kind of maybe what you would like could be other things that qualify as medical trauma?
Ooh, so like my brain immediately goes to the extreme of the extreme. Like botched surgeries, or like surgeries gone wrong, or like people who have had like things that they've had surgeries, they've had kind of like uh instruments or things left inside, so they had to have another surgery, or they had a surgery that like went wrong and had to have another surgery. Some of those things come to mind. Something else that comes to mind is just like the ill treatment, bad communication that sometimes occurs that can be traumatic in terms of like you're trying to find out information related to your health, and it can be very traumatizing when it doesn't feel like your healthcare team uh, doesn't feel the same way about your health that you do. Um, Yeah, that's some of the things, and then a lot of like ER experiences from low spectrum to high spectrum intensities can be pretty traumatic. I almost want to say to some degree, depending on which ER you're like going to, it can be traumatic just to sit in an ER and like be surrounded by like all of the traumas that you're watching people like experience while sitting in a waiting room.
Absolutely. Just being around things, seeing things. You could, I guess, in essence, be exposed to, I mean, being exposure to death, or like fear of death is one of the qualifying pieces of a PTSD diagnosis. There are other pieces, but that is one of the pieces there. So you could imagine if like you were in an ambulance and then were taken to the hospital, like that qualifies. So I think people understand that as medical trauma. But what Tiffany, I think you're getting at is really helpful. Like just sitting in an ER, maybe seeing a lot of different things, maybe being there for days, hours, not getting an answer. I think about some of those complex medical conditions. So you go for a general screening, you're like, I don't know what's happening at the ER. Think we probably know hundreds of people in our lives that have had this experience like this. They go, they don't get an answer, it's not clear, they have to do more tests, back and forth, specialists, referrals, different opinions. It can be very, very traumatizing. Also, some of my clients who have more of like chronic pain or maybe more chronic health conditions that they weren't able to discover right away, that is also traumatic because sometimes they will feel doubted or questioned. Now, sometimes that is a feeling and it's not maybe happening, but other times they really are being doubted or maybe flat out accused of malingering their symptoms or exaggerating their symptoms. Another piece to think about is if you are done some self growth and exploration, self diagnosis and exploration. But self diagnosis is not always wrong. Then you go to a doctor or a healthcare specialist professional and try to say, "Hey, I'm thinking that this is something I'm experiencing." Uh, that is also traumatic. It depending on how the reaction goes. I have my own memory of taking medications for my mental health, and I was really anxious about that. I wasn't as open as I am today talking about this with you, Tiffany. And I messed up the dose I was on or the med I was on, something like I didn't really know what I was taking. And my doctor was out sick, and the doctor I had filling in pretty much cut me up and down about why was I asking for more meds if I don't even know which one I'm on. Uh, so it was like kind of the opposite. People get accused of knowing too much and trying to go. I was just trying to say I didn't think it was working. And so because of that experience, I'm very picky about who I would see or go to. I'm not even on that medication anymore, but I still have that memory that I'm like, yeah, it was very invalidating. And I can't imagine what that would have been like if it was something more serious or important to my day to day life.
Yeah, yeah. I mean, it's hard to kind of think about, and I appreciate you sharing like that really frustrating, tough experience. Like, to some degree, I won't lie, it kind of triggers some of my experiences where I've like, this is my family's medical history. This is the exact same line, and you get the doctor who's like, well, your numbers on paper look great, so like you're wrong. And it's like, cool, I'm glad that like numbers get to dictate like how I feel when you like don't like you're not in my body, you're not feeling what I'm feeling.
Well, and I think
So that
that's
can have to be traumatizing too.
absolutely. I think so many people have had that experience that they're trying to express something, but maybe they don't express it the right way. And so then they're invalidated for like the way they've expressed it. So I think
Mhm.
some of this is maybe on us as consumers and patients to know how to speak to things. At the same time, it's kind of scary that we would have to do so much work. I don't know if you've seen some of those videos of people going in as healthcare advocates for maybe their older family members, or even just going with like think about expecting mothers and just to literally be a like a body, I guess, just literally to be like a hey, well, like just as that support. Uh, and sometimes I think we can feel like, oh, that's maybe overkill or unnecessary, but it's like sometimes it's not if we feel like we're really needing, you know, support to navigate maybe insurance. Like, if you don't recommend this, insurance can't help me. Or, hey, I really like, I've gone 5 times, I've done this, it can get, I'm very frustrated. Now, I think there's just, again, caveats and context of things. This is not like you can show up to a doctor and say, give me this diagnosis, give me this. there's like processes, but what we're talking about is people who are trying to use the system the right way, trying to get real needs met. And there is this challenge in the system that I think can create medical trauma. And I think that's where it's different from compassion fatigue, different from PTSD. Is like you can have experiences like this, and it is medical trauma, and it can make it harder to do healthcare seeking in the future, or even want to be open to this in the future as well.
Mm-hmm. Yeah, yeah. There's a lot of spectrum ranges of traumatic experiences that we can have on an individual level that can really color how we, go about handling ourselves within the medical field and like seeking help.
Yeah. And so I think one of the things to kind of notice if like maybe these are going to sound very similar, symptoms of medical trauma. So one of the things to think about is PTSD symptoms of anxiety, avoidance of stimuli, depression, digestive issues, emotional numbing, exaggerated startle responses, fearfulness, flashbacks, hypervigilance, intense emotions, intrusive thoughts, memories, and nightmares, muscle tension, and sleep disturbances. So those are all symptoms of PTSD, but also could be symptoms of medical trauma. And just another, I think, helpful definition, trauma is when our nervous systems are overwhelmed by an event or events. It's not that you can't get over it, and it doesn't matter how serious that it was.
Hmm. I think that's a pretty encompassing description. I don't know. Um,
Anything you would add?
yeah, I'm kind of at a loss of wanting to add anything because I feel like it's a nice, good summation.
So I think kind of maybe getting into interventions, and maybe things to kind of go. So kind of going through maybe steps one could take to kind of move forward. So finding a trusted source to kind of explore this with, so whether it's a family member, friend, or colleague. It could be different. I'm talking to a fellow therapist right now, but maybe exploring through like, hey, is this normal? But you're not having to share everything, but maybe just sharing a piece of like, hey, uh, just exploring some of the different pieces. So I think that is something that can be very helpful just to kind of maybe talk through and explore. Tiffany, if you had maybe a patient with you or a client, what would you say would be things you would approach?
Ooh, so in terms of like, let me clarify because my brain is going in a billion
You're
directions.
okay.
So in terms of like working with someone who has medical trauma or like being around someone that has medical trauma.
Say that one more time.
So like, are you asking me like if I'm working with someone who has medical trauma or if it's just me being around someone who has medical trauma?
If you're working with a client or patient that's maybe discussing medical trauma and trying to maybe explore next steps, what do you typically talk with them on or maybe explore with them?
So I think the first thing I want to explore is the anxiety. The anxiety levels that they're having regarding like past experiences and any potential future experiences they may have to engage in, as a result, of monitoring your health. I also want to look at ways that they've been invalidated or like they've experienced trauma, so that like we can work together to explore healthcare providers that are well known within the community or well connected to like people that I work with closely that are highly recommended, that are aware of and how to work with people who have had past medical traumas so that they are part of the support team and not part of the problem as I'm helping this client kind of like address the medical trauma and any fears or anxiety they might be having, especially if it's someone who like needs consistent medical attention.
I love that. I think sometimes with my patients, I'll try to just let them like tell their story fully and let that energy out because I think it can be very tense and escalating and overwhelming, and maybe like kind of stick to them. So kind of validating those experiences, but also maybe making a plan for how they can approach that in the future.
Yeah.
I think one of the things that we also wanted to talk about was kind of myths that go along with healthcare trauma. Uh, would you maybe think, Tiffany, what's like the biggest myth that people have when they're thinking about the topic of medical trauma?
So one of the myths that popped up quite often when I was like doing a little bit of light research on this is that healthcare professionals are immune to medical trauma because they're in the field.
Mm. Why do you think that people think they should be immune?
Well, a lot of like what I was reading is like because of the high stress nature of their work, they are used to it. They're kind of numb to the experiences. They've been exposed so much that it's not something that like could like traumatize them. I'm using air quotes, traumatize them
Mm.
because it is the nature of their job, which is very flagrantly not true.
Yeah, almost like we have superhero capes and things don't impact us in the same way.
Yeah. You're in it all the time, so you must be desensitized to it. It can't bother you. Kind of like, so I don't know if you've ever experienced this. I know this is a little bit of a side tangent, but like sometimes I've encountered people who are like, oh, you must be so used to hearing about like all the bad things. Like bad things just might not affect you anymore. And I'm like, no, I'm a human. Bad things still really impact me.
Yeah, I don't think we can be limitless in how we're able to address or handle things. Like I do think we all have nervous systems and they all respond differently. And there is, even if you're trained to handle something like a therapist, like a ER doctor, like a police officer, like a vet, like whatever the role is, there are still things that are going to bother us.
Yeah. Actually, like studies show that like the rates of depression, anxiety, PTSD are actually higher among healthcare workers compared to the general population.
Yeah, I do think PTSD is about the same rate within the general population and in healthcare providers. It's usually about the same. We have the same access, maybe sometimes increased access to support. There are some challenges with taking up the support and realizing that we need to build support in the self-care and the outlets. But I do think there's some challenges with knowing when to reach out for help.
Mm-hmm. Yeah. So looking at this, another myth that popped up was only major traumatic events tend to cause PTSD. Like a lot of that myth is kind of revolving around the idea of like little things that someone might not consider traumatic aren't overarchingly, in that like trauma spectrum.
Yeah, I mean, I do think there are lots of trauma, and I think one of my favorite details within PTSD is the idea of fear of real or imagined or percepted like trauma or deaths. I think that's something that's important that like, we can be exposed to something. Um, and it doesn't have to be direct and it doesn't have to always be real. Like sometimes it's like this fear of learning. So for example, if there was like a natural disaster or a other type of crisis happening, that would qualify, even if you weren't directly impacted.
Yeah. Yeah. And then that kind of goes into that idea of like vicarious trauma. Like you can have vicarious trauma that can lead you to have PTSD symptoms.
I think another myth, maybe just to add to this, is that trauma happens to weak people, and if you were a strong person, you would not be impacted by healthcare trauma and all of the pieces with that. Um,
Mm.
I don't think that's true. I think that trauma is an equal opportunity thing, and we all have breaking points. So even if you're like one of the toughest people in existence, there's still a breaking point to that. We're not meant to just be limitlessly taking on stress, anxiety, or overwhelm.
Yeah. Yeah.
So that, I mean, maybe a shorter review and piece on just kind of getting into medical trauma. I think some of the things we've talked about looking at in the future, maybe specific types of medical trauma, getting a little more um, detailed. But Tiffany, is there anything else you wanted to go over today specifically? That's most of what I had to go over.
Yeah, so I think I'm gonna like diverge just a little bit. Hopefully that's okay. Something that kept coming up across my research is that talking about mental health issues within the healthcare system can cause harm to your career was a common myth that kept popping up. And I thought that was an interesting one.
Why does that stick out to you?
Well, I don't know. It to me it seems interesting that like people in the healthcare system like hold that mythological belief that if they talk about mental health and their mental health issues, like it can have devastating impacts on their career. Like I feel like that speaks volumes to about like the nature of environment they're living in, whether it's like of course it's a myth, but like the fact that like people are holding on to that as a truth.
So, like, the idea maybe in this myth is if you talk about something, it's going to make it worse. So, like, you shouldn't talk about it. Like, is that what you think this comes from?
Yeah, I think it's rooted in fear of like if I'm in the healthcare profession and I have like I don't want to throw anyone under the bus, but let's say I have severe anxiety or like I have a panic disorder. Me talking about that might look bad. Or like if my clients or patients hear about it, like they might not want to come to me. Um, Kind of like that idea of like if I skew the public image that I'm caring for myself, people might not want to like come and see me.
So, almost like if you've ever been wounded before, even if it's healed, that precludes you from being able to help people or other people wouldn't want to go to someone.
Yeah.
Yeah, I think it's interesting because I've experienced the exact opposite of someone. I feel like most of the time people want someone with the shared experience to maybe have some understanding or empathy, not the exact same. Uh, but also, I think there's a difference in like, hey, I have these wounds. I've had these wounds. These are healed versus like, someone actively wounded to a point where it is interrupting what they're able to work on.
Yeah. And like on that same vein too, like if this myth is being held within our healthcare provider network, I can only imagine like the trauma they experience from like having to hold other people's physical and mental trauma at times, while also figuring out their own like coping skills for the trauma of like, oh, like I have to present a certain image, um, based on like false information I've been told about how to handle these really hard events. Um, so like when I think like the first thing that comes to mind is COVID. You only imagine like how much trauma our healthcare professionals held on to as they tried to like quote unquote hold it together, like during that traumatic period in time while also carrying on the traumas of their patients as well.
Yeah, I do think COVID made a lot of people leave both the mental health and just healthcare sphere and a lot, and we're still feeling the impacts of that today. And also, yeah, there's just a lot of things that we can be impacted by. Uh, and it's okay to be impacted by something and then work to address it, or kind of there's that survive mode. But I do think it's like recognizing the challenges of the roles we take, finding that balance, finding those boundaries. Easy to say, much harder to do. I do think that was a worthy
Mhm.
add-on. Is there anything else, Tiffany, you brought in that you were wanting to get into today?
I think the last thing I wanted to like openly discuss is like strategies that like we can like help to implement to help address like trauma in the healthcare, both like within our professional seats and like for the general public.
What are those pieces that you would maybe want people to know?
Yeah, so like promoting open dialogue, encouraging open discussions about this, fear and stigma of professional repercussions around like trauma, like in the mental and medical health fields. Um, if you are open to it, go to trainings that like focus on like how to advocate for individuals who are experiencing this, um establish support systems so that you feel like you're safe in like ways that you're going about managing your health in a system that like you may or may not have been traumatized in. Advocating for policies, that help promote a better work-life balance, a healthier culture within the healthcare field. And then helping encourage everyone that self-care is important, like across the field. Like I know that's kind of like I don't want to sound like I'm on my soapbox, but
You're allowed to
but
be on a
being able
soapbox.
to like recognize that like self-care is important across the field, and if we're caring for ourselves the way that we would want to care for others, it can help minimize the negative and traumatic interactions we pass on to the people around us.
Yeah, I think that's really profound, and I think it's something that's worth sitting with and exploring, and maybe having just be the last maybe big takeaway from this episode today.
Yeah. So just trying to get out there and like find change if you're open to it, not forcing people to do it in ways that like make sense for
Yeah.
you.
Yeah, I think it's okay to be impacted by things like medical trauma, and it's also okay to talk about these things and explore. And I'm sure we'll come back to this topic, maybe a more detailed portion of it at some point. But I think this was a really great opening piece for today.
Yeah, yeah. Well, I want to thank you, Eric, for being here and bringing this topic to us. I kind of look forward to diving into a little bit more deeper aspects, maybe of some of these topics we brought forth today. What about you?
Absolutely, yeah. No, I appreciate your myth section, Tiffany, and just ways to identify it, and also like maybe ways of approaching it. It's always fun to get into this, and I have to say I'm really enjoying us getting to be really focused in on trauma and getting to use those skills we both have.
Yeah, yeah. Well, thank you guys again for joining us, and we look forward to seeing you all on our next episode. And don't forget to join our Patreon. We have all of our resources there. They're open discussion boards. We'd love for you to come and discuss and add resources and just enjoy that open space.
Thanks, everybody.
Thanks for tuning in to this week's episode of Deciphering Growth. We hope you found our conversation helpful and insightful. Subscribe to our podcast for more episodes and check out our Patreon for more content. Don't hesitate to contact us on social media if you have any questions or comments. We'd love to hear from you. Until next time, keep growing.